My question is to the Minister for Women and Government Services, Minister Gallagher. In a letter from Services Australia, dated July 2, 2025, it confirms that the stillborn baby payment of $4,326.57 is available in cases of intentional abortion where a pregnancy has reached 20 weeks or the child weighs 400 grams. While One Nation supports the stillborn baby payment for legitimate and heartbreaking cases, Minister, why is this payment being made to women who deliberately abort a baby?
Thank you, Senator Hanson. Minister Gallagher.
Thank you. Thank you for the question. I know that there is a number of steps that are taken before a family that's been affected by stillbirth are eligible for that payment. It includes a number of different pieces of documentation, but that payment, supported by that appropriate documentation, will be paid in those circumstances. It includes, in often quite traumatic circumstances, as you can imagine, evidence of the stillbirth from people who were attending the birth. That is required before the payments are made, associated with other documentation that's required by Services Australia to make that payment provided. We accept that in the case of stillbirth, it is a very traumatic situation for anyone who is involved in that. And I think even applying for that payment at times can be quite traumatic, and so we've looked at ways to make sure that that is as seamless as possible. But like every other payment that's required and provided by Services Australia, those payments are made in accordance with the law and in accordance with guidance and evidence that those payments are appropriate. It's that for whether it's job seeker, whether it's single parenting payment, whether it's PPL, and in the case of the loss of a baby through pregnancy loss, those payments will be made when that is supported by evidence that's required by Services Australia.
Thank you, Minister. Senator Hanson, first supplementary.
Well, Minister, you never answered the question, which was, why is it made to women who deliberately abort a baby? Minister, this policy risks creating a financial incentive for late-term abortion where Australian women can terminate a pregnancy up to the day before birth. They can terminate a pregnancy up to the day before birth, allowing women to receive a lump sum payment and access to paid parental leave of up to $22,754. Why is the Albanese government funding the murder of healthy babies, some left to die in a kidney dish for up to 5 hours?
Thank you, Senator Hanson. The time for asking the question has expired. Minister Gallagher.
Well, the answer to that question is the same as to my earlier question. There are laws in this country around termination of pregnancy. They are laws that are regulated by the states and territories, and I support those laws. One of the reasons I got into politics was to ensure that women had the right to make choices about their own reproductive health. I accept that some people disagree with my views on that and with laws in states and territories that provide the regulatory arrangements around that. Now, in relation to the stillborn baby payment, as I said, and as it relates to other payments, including PPL, evidence is required, documentation is required before those payments are made. In relation to the stillborn baby payment, that includes certification from someone attending the birth, a health professional attending the birth, that the birth was of a stillborn child. That is the documentation that's made or required in order to receive that payment.
Minister. Senator Hanson, second supplementary.
Minister, when you talk about stillborn births, let me inform the public of this nation, that they are actually injecting a needle into the heart of the baby before it's born. Therefore, it is born stillborn. Minister, will you and the Albanese government work with One Nation to close this appalling loophole and ensure these taxpayer-funded payments are reserved for genuine cases of stillbirth, not for barbaric late-term abortions carried out by choice?
Thank you, Senator Hanson. Minister Gallagher.
Thank you. Well, my answer to this is, as it was to the earlier two questions, I have not seen any, and I have not had raised with me outside of this chamber right now the concerns that Senator Hanson raises with me. But in order for a stillborn baby payment to be paid, what is required is a paper-based form from the hospital containing a doctor and midwife's declaration that it is used as a verification of the stillbirth. That is what is required to get that payment.
Minister Gallagher can't even define the term stillborn. The government conflates a stillborn baby with an aborted baby. I'm confident a lot of Australians understand there is an obvious difference. A stillborn baby is a baby that dies in the womb, the implication clearly being it is not intended to the baby to die. An aborted baby, on the other hand, is a baby whose survival was not intended in the termination of a pregnancy, but according to the government. The government's definition of a stillborn baby under taxation law of all things is in the letter in which I referred in my question. A child who weighs at least 400 grams at delivery or whose period of gestation was at least 20 weeks and who has not breathed since delivery and whose heart has not beaten since delivery. And it's based on this definition that women seeking abortions are eligible for a taxpayer-funded stillborn baby payment of $4,326. That is one hell of a loophole, which I'm confident is offensive to many Australians who don't approve of late-term abortion. What we know is that these babies are being murdered in the womb with a lethal injection and then being delivered as stillborn, so technically that makes these women eligible for stillborn baby payments and even maternity leave. There is an immediate need to close this loophole and tighten the definition in the new taxation system, Family Assistance Act of 1999, to ensure women who have abortions are not eligible for a stillborn baby payment. Australia should not, in any way, shape or form, be financially incentivising abortions via payments intended for parents of stillborn babies. During my question, I heard roar from the Greens. Of course, they're all for murdering of babies. This is happening that they can actually have an abortion right up the day before actual birth of that child, and they inject the child, it's still in the womb, with a needle into the heart, which kills the baby. And some are born and left in kidney trays for 5 hours to die with no help. Let them be adopted out. Disgusting. Shame on the government.
Senator Hanson, to be honest, was waiting for someone to stand, but I will ask you to withdraw the comment regarding the Greens' approach to I don't want to repeat the phrase, but I think you should withdraw that phrase.
I will withdraw that comment. They're precious.
Senator Hanson, please withdraw unreservedly.
I will withdraw unreservedly.
Thank you.